All right, welcome everybody. This is Health Talk, and again, it's sponsored by Providence Health and Services in Western Montana. This is a special half hour we take out to become more informed and better educated about the services that are offered at Providence. And I know that probably everybody out there at some point has experienced what you might call chronic pain. So I want to say hello to Dr. Patrick Davis, who's with us, a clinical psychologist with the Montana Spine and Pain Center. How you doing, Pat?
I'm doing well, thank you, Peter.
I understand you've been preparing for the big half marathon, right?
I am preparing for the half marathon. Yes, okay. I am.
All right. So now, when you go to work in the morning at the Spine and Pain Center at Providence, tell me what that's like for you. I mean, what is it that fires you up about going to work in the morning?
Well, the Spine and Pain Center is a very enjoyable place for me to work. We have a very nice crew of people to work with. People who are really dedicated to helping folks better manage pain that they may experience persistently in their lives. And people who really try to stay on top of the science and sort of the art of working with chronic pain, because it's such a difficult problem for so many people.
I was going to ask you about chronic pain, because for those who just have every now and then a little ache and pain, maybe you lift something you shouldn't, it hurts for a while, then it goes away. Tell me the difference. Tell me exactly what is chronic pain. Is there a clinical definition?
There are actually multiple definitions of chronic pain, so it can be kind of confusing sometimes. But I think a good definition of chronic pain is simply pain that's lasted longer than you would have expected it to last.
Okay. And so like when I go into the hospital and visit somebody, luckily it hasn't been me, and I look at there's a chart that says, what is your pain level? And then there's 0, and then there's 10, and there's all sorts of hand gestures of how terrible. How do you deal with that? And as far as working as your work in the spine center?
Well, in terms of trying to assess a person's pain level, it really is what the person says that it is. That's about the only measure that we have. Mm-hmm. We can ask them about that in a number of different ways. We can ask them to rate their pain on a scale of 0 to 10, where 0 is no pain and 10 is the worst pain they can imagine. We can show them a series of pictures which illustrate different looks on a person's face to illustrate how bad the pain is. Or we can ask them about their pain in terms of how much it interferes with their behavior. Mm-hmm. So there's a variety of ways that we can try to assess it, but it always comes down to what the person says that it is.
So when it comes down to what is treating chronic pain, how is that different from someone who just comes in with an owie and they need some mild sort of pain relievers to get through maybe after a surgery or whatever?
Well, with the owie sort of situation, usually what has happened is the person has caused some kind of tissue damage to their body. Right. They've hit their thumb with a hammer or fallen off the ladder or something like that.
Put their hand in a snowblower. I did that.
Something like that. That's right. And so in those situations, there's usually some tissue damage, and there's an expectation that tissue damage will heal within a reasonable period of time. And so oftentimes there are pain relievers that are prescribed, kind of depending upon the severity of the injury. But those pain relievers are thought to be needed only really for a couple of weeks, something like that. And typically, that's about all you really need to do. If there's been some kind of a more serious injury and a bone needs to be set or a laceration needs to be stitched, there might be those kinds of interventions. But the expectation is that the pain will subside fairly quickly.
What is it that causes chronic pain? I mean, are there specific injuries or illnesses that you can just you're going to look forward to a long period where you're going to have pain?
Well, there are certain kind of degenerative or autoimmune conditions which can cause pain over the long term. More often when we think about chronic pain, really what we're thinking about are people who've had injuries of one sort or another, fallen off the ladder or been in an automobile accident. Or
you keep looking at me. I fell off a ladder. I mean, you must know my history. You must have been talking to Dr. Puckett, I think.
Maybe that was it.
Anyway, go ahead.
Well, that's just an example that I use quite frequently when I'm trying to explain the difference between acute pain and chronic pain. I like to say that if you fell off the ladder last week, you've got acute pain. If you fell off the ladder 5 years ago and you still hurt, you've got chronic pain.
Okay. We do have a caller, so strap those headphones on, if you wouldn't mind. Let's get our friend Catherine on. Catherine, good morning. You're on with Dr. Patrick Davis. Good morning.
Good morning. I just one quick question. Is there a problem with long-term use of NSAIDs like aspirin or Advil to manage chronic pain?
Good morning, Catherine. Well, I'm a psychologist, not a pharmacologist or a medical doctor, so this is really not a question that's within my scope of expertise. Oh. But with NSAIDs, I think that they can be pretty tough on the gut, actually, and so you have to be a little bit careful about how much of them you use. You'd want to talk with your physician about the maximum daily dosage that you would use.
Okay, let's talk about, I've got a question here. Is there an objective way to measure pain? I mean, is there some chart that says this is, and this isn't?
At this point, there really is no objective way to measure pain. It's a subjective report that comes from the patient. As I said earlier, pain is what the patient says that it is.
Okay.
There is work that's going on in the field of neuroscience trying to identify specific neuro patterns in the brain that are associated with the experience of pain. But the problem with that is that people can simply imagine experiencing pain and trigger those types of neural patterns as well.
All right. So as we move forward, as you begin to work with people, is there a certain length of time that's relatively average for chronic pain, or is this something that is you're going to be with us for the lifetime, and so we're going to get used to seeing Dr. Davis on a regular basis?
Well, we hope that it won't be with us for the lifetime, and part of the approach that we take at the Montana Spine and Pain Center is an approach that focuses, at least in part, on trying to rewire the way that the nervous system processes sensory information. So we're taking advantage of modern neuroscience's understanding of this thing that we call neuroplasticity.
Okay, what is neuroplasticity?
Neuroplasticity is the reality that the nervous system is always changing every single day based upon our experience and the things that we learn. So that in a sense, when we live with pain for an extended period of time, it becomes a learned experience. And so there are things that we can do to unlearn it. It has to do with the number of synaptic connections between different nerve cells, receptor site density. It all gets kind of complicated and deep into the weeds. But the basic idea is that when you learn something, when you experience something over and over again, your brain and your central nervous system actually change to make it easier for you to have that experience. And so part of our program is focused on trying to reverse that phenomena.
It sounds almost like you want to send people to pain school, right? And we want to talk about that school when we come back after a break. By the way, Dr. Patrick Davis joining us here in studio. This is Health Talk. It's sponsored by Providence Health and Services of Western Montana. All three lines are open. Do you have a question perhaps the doctor can help you with, or point you in the right direction? 721-1290 is our number. We'll be right back. We're back on Health Talk, sponsored by Providence Health and Services Western Montana. Dr. Patrick Davis joining us here in studio. He's with the Montana Spine and Pain Center. We got kind of introduced the subject of a pain school. So what's this all about? I mean, is there a classroom? Are there tests? I mean, do we get to graduate someday? What's the deal with pain school?
Well, that's all pretty much true except for the tests.
Okay.
There are no tests. Our pain school is it's actually sort of a more simple way to describe what we otherwise describe as a neurobehavioral rehabilitation program. And so we just simply call it the Pain School program. We've thought over the years of coming up with some kind of fancier name for pain school because nobody likes pain and nobody likes school, but we haven't been able to come up with a better names for it. So pain school it is, and pain school it's been.
The Discomfort Institute. How's that?
Something like that, yes. Okay. We'll take that under consideration. Yeah.
All right. Now, so how does one get into the pain school?
Well, typically a person would be referred to our program by their primary care provider or perhaps by some other specialist that they might be working with. The first thing a person does when they come to the Montana Spine and Pain Center with chronic pain is they'll meet with myself or one of the other psychologists that are a member of our program, and we'll do an initial what we call behavioral health assessment. And early on in that process, we'll make a determination with regard to whether or not that individual would benefit from participating in the pain school program and whether or not the group program or individual treatment would make more sense for that particular person. Let
me ask you, it's fascinating to me that one of the first people you would see coming to the Spine and Pain Center would be a psychologist. Is that because so much of what we experience of our pain is in the brain, or it's just how we perceive it to be?
Yes, in the brain and in the nervous system. And I hasten to add, because people often misinterpret that sort of remark as saying that their pain is all in their head or imaginary. And so I want to emphasize that we don't take the perspective that people are imagining their pain or that their pain is all in their head, aside from the fact that that's where the brain is located, is in the head. But when we're talking about chronic pain, so much of chronic pain is influenced by changes that have occurred in the central nervous system and even in the peripheral nervous system, and especially then in the brain. And there are structural changes that have been identified in the brain among people who have chronic pain. And those changes changes in the brain also change in the other direction, oftentimes with treatment. And this has been documented again by MRI studies that have looked at this sort of thing.
For those who don't suffer from chronic pain, do you find that they have a hard time identifying with people who do have chronic pain because they miss a lot of work, maybe they miss sports games or whatever, they miss various family events because of chronic pain? Do you find that other family members or coworkers kind of have a hard time dealing with that?
That is often the case. And it's interesting that a lot of our patients will tell us that they used to have that same attitude, that they used to be very intolerant of people who would miss work because of chronic pain.
Suck it up, be a man, right?
That's right.
Yeah. And so how do you coach people through? In other words, do people who are related to folks who are suffering chronic pain, do they also become part of the pain school? Can they begin to learn what this chronic pain is all about?
Yes, we welcome family members to participate in the pain school program, whether the person with pain is coming in for individual treatment or whether they're participating in the group program. Family members, caregivers are welcome to join them.
How does chronic pain change a person? Let's say you start out being a happy-go-lucky guy or gal, and you encounter some injury or illness, and all of a sudden your body is racked with this pain. How did personalities and various things in yourself, how do they change through chronic pain?
It's very common, actually, that people who have been living with pain for a long period of time will develop problems with anxiety or depression that they may not have had prior to developing the problems with pain. And then in addition to that, people's lifestyles just become much more sort of circumscribed, much
more limited, right?
Sort of limited because people don't do the kinds of things that they used to do. And I think one of the biggest difficulties for people with chronic pain is that they don't feel that they can make appointments or schedules that they can feel confident that they're going to be able to show up for. And so when they're invited to certain kinds of social gatherings or family events, those sorts of things, oftentimes they'll beg off, not because they don't want to participate, but because they're not sure how they're going to be feeling when that day comes.
Sure. And that sometimes can be a strain on family and friends and coworkers, right?
Absolutely.
All right. So is there a way that perhaps myself, I have worked with a person with chronic pain, and after a while, really good friends with this person, and after a while, it just got to be really difficult to maintain that level of friendship because I didn't understand what that pain was like. Mm-hmm. So where does somebody like me go to try to help understand that, aside from just trying to be empathetic and talking with the person?
Well, there are lots of resources available for people who are living with persistent pain or for people who just care about somebody who's living with persistent pain. And so if you were intimately involved with someone who had chronic pain, you could come to our pain school program along with that person and learn an awful lot about chronic pain in that way. But there are some good resources available in terms of self-help books and now web-based resources as well, where you could go and learn a whole lot more about the experience of chronic pain and perhaps how best as a loved one or a concerned friend or colleague to relate to that person.
How is research changing the way you look as a healthcare professional? How is research and what's going on now, the various advances that are being made, how is that changing the way you look at chronic pain?
Well, research is very fundamental, and the area of chronic pain is actually a very active area of scientific research. There are numerous journals dedicated to the issue of pain, and an awful lot of that is chronic pain. This goes back a little bit to a question you had earlier about it being unusual that you would come to a pain clinic and meet first with a psychologist or a behavioral health clinician.
Mm-hmm. Right.
But research is telling us that chronic pain has more to do with the way the nervous system processes information than it has to do with ongoing tissue damage or injury to the body. And that our own behavior is the fundamental factor that contributes to the persistence of chronic pain. If you think about it, that really kind of makes some sense because we're talking about chronic pain, which is one of many different chronic health problems that we might suffer from. And this is true of all chronic health problems, or almost all chronic health problems. They're really driven by our own behavior.
So what behaviors can I have to help me get through chronic pain? What can I develop? Let's put it that way.
One important behavior is, to the extent that it's possible, and you need to have the reassurance of a physical medicine provider that it's safe, but probably the most important thing is to resume normal functioning. Oftentimes people think that because it hurts that it's not safe. And this is often the case if it's acute pain, but with chronic pain, quite often physical activity and movement that is painful is not dangerous at all. And in fact, working back in the direction of reclaiming lost movements, lost activities, is really the ticket to getting the brain rewired so that we have less pain.
When every now and then when I get a little bit of sciatica, my first inclination, get on the easy chair, put my feet up and just relax. But I find that it's much more effective for me to get out and walk, just a nice relaxed stroll, and that eventually helps my body get back into the place where whatever that nerve is can be reset, and it takes a lot less time than if I have bed rest or just try to sit around.
That's right. And if you spend too much time in the recliner, what you're doing is you're losing bone density, muscle mass, and joint flexibility. So it's more likely that the more downtime you spend, you're going to experience more pain, and the pain's going to last longer.
We're going to take a little break, come right back. All three lines still open. Dr. Patrick Davis talking about a fascinating subject, and that is chronic pain. 721-1290 is our number. We'll be right back. And we're back on Talkback, and this is Health Talk, sponsored by Providence Health and Services, Western Montana. Dr. Patrick Davis joining us. Interesting topic that we're talking about off mic, and that is, what is the purpose of pain? And anyway, because especially when we're really hurting, is it why do I have pain? What is the purpose of pain in the first place?
Yeah, it is a very interesting question, and it goes back to that distinction we made earlier between chronic versus acute pain. So the basic function of pain is that it's an alarm system. It's a way that our brain tells us that we're doing something dangerous that may be damaging to the body. So there are many situations where we may experience pain, although we haven't actually damaged the body, like when we stand too close to the campfire, and the pain of the heat of the campfire tells us to back away. The pain is an alarm system. It's saying you're in a dangerous situation, you need to change your behavior. Similarly, if we have injured ourselves, quite often if we immobilize the injury, the pain goes away. But then if we start rubbing it or bump it into something, it hurts an awful lot. And again, that's pain telling us to leave that injured body part alone so that it can heal.
Now, what happens, Dr. Davis, when there's a condition where people literally, physically cannot feel pain? Why is that so dangerous?
Well, because people would not be able to take appropriate steps to protect themselves from dangerous situations.
Okay. We have about 2 minutes left in the program here. So if folks want to get more information about chronic pain and about the Spine and Pain Center, can you tell us how to get in touch with you, and what's the procedure with getting into the pain school, things like that?
The best way to get involved with our program is to get a referral from your primary care provider or from another specialist that you might be working with. We have a well-established referral process at the Montana Spine and Pain Center. If you do get referred, we'll invite you to come to a new patient orientation meeting that we have every week. That's a group meeting. You can also go to our website. We have some web pages associated with the Pain School program, and you can get there simply by Googling Missoula Pain School. If you put that phrase, Missoula Pain School, into your web browser, the very first link that will come back will take you to the Pain School Resources web page. And there's a number of links there, including a link to a variety of educational internet videos. So there's as well as information about the Pain School program itself. A couple of other websites that you might check out that are not Providence websites, but they're good ones that we refer people to, are bodyinmind.org. That's bodyinmind.org. And lifeisnow.ca, where the CA stands for Canada. It's a Canadian website.
All right. It's been a pleasure. Thank you so much for being a part of the show. Is there a phone number we can call to get in touch with your organization there?
The main phone number for the Montana Spine and Pain Center is 327-167. I think it's 1670.
Okay, got it. Perfect.
Yeah, 327-1670.
Good catch. Dr. Davis, thanks for being with us.
Thank you very much, Peter.
Appreciate it. And that's going to do it for Health Talk for today. Thanks for joining us. We'll do it again next Monday, ladies and gentlemen, sponsored by Providence Health and Services, Western Montana. So we'll continue. We have Talk Back coming up, open phones for the next hour. Hope you'll keep it right here.